Thank you very much, Mr. Chairman. I must start by thanking Sama for inviting me to this meeting and to meet colleagues and to share experiences. My presentation is really going to overview a small introduction on Sudan Medical Council and then the efforts we are doing and share with you some of our concerns. Now, Sudan Medical Council Act was passed in 1955, immediately with the Act of University of Khartoum after independence. However, the council established in 1968, and the first Code of Medical Ethics was in 1969, and that is the start of the work. The aim is to deliver and safeguard high standards of medical education, medical practice, medical ethics in the interest of patients, the public, and the profession. Our duties include registration and revalidation, medical license examination, accreditation of medical, pharmacy, and dental schools, disciplinary functions, and medical education reform and monitoring. As far as registration is concerned, we have 4 registers: the provisional for graduates to work under supervision, the medical officer register, the specialist register, and the temporary register for doctors who are non-Sudanese working in Sudan. And our mandate actually takes the general sector, the private sector, the military and police services, and the NGOs, where nobody is allowed to practice if he's not registered. Now, the development here is that we developed the specialist register into a 3-tier system. On graduation from Sudan, obtaining the postgraduate qualification, in the first 3 years, he will be working as a specialist. The next 5 years, he will be a senior specialist, where he will be a consultant after 8 years of training of practice or more. To upgrade to any of these tiers, the candidate must provide evidence of good performance and competence and collect continuous medical education points. Performance logbook, training accreditation of training institutes and courses are our mandate with other partners. We're not going to do those activities, but we are the ones who are going to accredit whoever is doing a CPD activity and give points to the courses. Now, the tools are developed by Sudan Medical Council, and this is the policy and guidelines, and the other one is the logbook for that. We managed actually to document and publish the medical register. The last edition was 1979. Now, the 2010 register is having 28 actually 1,000 doctors. Among them are 22 medical doctors, 4,500 pharmacists, and 2,000 dentists. Now, Sudan National Formulary is also mandated by the law, and it is now in press actually. This is the initial cover. Design but they could a little bit different, but it is, we are expecting it to come out soon. Our disciplinary function is discharged through a professional and ethical committee, complaints committee, a penalty committee, and an appeal committee. We have 4 those. The other big mandate, and that was mandated by us in 2004, by the change of 1993 law amended 2004, added to us the task of accrediting medical schools, dental schools, and pharmacy schools. An accreditation committee was formulated in 2004, before we started our tenure, and a national accreditation system was developed, where the purpose is to ensure production of graduates competent to practice safely, effectively under supervision as interns, with appropriate foundation for lifelong learning and further training. Now, these are our partners: Ministry of Higher Education, Ministry of Health, WHO Sudan, Sudan Association of Medical Schools, the National Medical Specialism Boards, heads of the Doctors, Pharmacists and Dentists Union, Sudan Medical Specialization Board, the medical corps in the army, the police, medical services, Sudan Medical Student Union, and a number of community representatives. Now, the national accreditation system developed actually national standards based on the WFME global standards and the Model College of Medicine, and here this is the national standard adopted by Ministry of Higher Education. Some procedural aspects from the Australian Medical Council and WHO EMRO guide on accreditation. The procedure is a self-evaluation and a site visit, and the legislations and bylaws for that process were developed by Sudan Medical Council. These are our main actually reports. As you know, WFME has got a trilogy of standards for undergraduate basic education, for graduate, postgraduate training, and for the CPD. We are working with the first part of the trilogy. Now, these are the domains that are within our standards: mission, objectives, educational program, the students, the academic staff, the educational resources, the program evaluation, governance and administration, and continuing renewal. Under each of these, there are subdomains, and we are utilizing about 36 subdomains, and 4 to 5 in each area. Now, our tool really is, this is called the Accreditation Committee data collection form, بتلقوه في الويب of the Sudan Medical Council, the details of it. Now, the next phase, and this is where we accelerated actually this form, we had advocacy workshops for deans, representatives from medical schools who are in charge of curricula and training of assessors.